Hello, everyone. Thank you so much for joining, and welcome to the Kindness and Smile Zones webinar. We're so excited to have you here today. Thank you for taking the time to join us. Today's webinar is all about how getting to know healthcare professionals, who they are, as it gives insight into aspiring medical students with a description of important healthcare careers. Before we start, we want to share a little about ourselves. The Kindness and Smile Zone is a space dedicated to promoting well-being, kindness, and learning together. We host webinars like this to share knowledge and practical tips on important medical topics. I founded the Kindness and Smile Zone in June of 2025 to bring smiles and kindness to children across the globe. Except for webinars, we post weekly activity packs, kindness cards, coloring pages, and blogs for children facing difficult situations. As a young patient myself, I understand the importance of this and invite you to visit our website for more information. I'm glad to see you all here today and be able to contribute something back to my community. My name is Iona Despois, and I'm a current 10th grader in Canada, and I'll be your host today. I'll just introduce Peyton for herself. I also have Peyton Ford along with me, a volunteer and current high school junior in Florida. Just a few things before we start. The webinar is being recorded and will be posted on our YouTube channel, so please keep your microphone muted. You can type questions in the chat anytime, and we'll answer them during the Q&A session at the end. And we'll also share a feedback form at the end, so please fill it out. Your input really helps us improve future webinars. So now I'm thrilled to introduce our guest speaker, Kate Tucker, a second-year medical student at NOSM University, Director of Internal Affairs at the Young Canadians Roundtable on Health, and a Bachelor of Interdisciplinary Leadership and Master of Applied Health Services Research. So over to you, Kate.
Awesome. Hi, everybody. Thanks so much for having me. It's really a pleasure to get to chat with you all. So like the introduction said, my name is Kate. This is going to be pretty informal. Like I have the slides. I'm going to do a lot more talking than there is content on the slides. Please feel free to put information in the chat at any point. And thank you to the Kindness and Smile Zone for inviting me and also for sharing the slides today. So we'll kind of get started. I'll do a bit of an introduction on the next slide, but we can go to the next slide for now, please. Okay, so as I said in the introduction, super nice to be here. I am in my second year of medicine at the Northern Ontario School of Medicine in Sudbury. I'm going to go over like a little bit of my background on the next slide, but today I've been asked to talk to you about becoming a healthcare provider. I found it really helpful when I was in high school to talk to students who were already in medicine or who were thinking about going into medicine, or students who were in like nursing, rehabilitation sciences, like physiotherapy, occupational therapy, social work, to kind of decide what it was I was interested in, if I was interested in healthcare, and like what I wanted that to look like. So thinking about how I could tailor my like personal life and also academic life to get into training programs for those. So we'll talk a lot about like what it takes to become these types of providers and why you might choose one over the other, why one might be more interesting to you or a better fit. And then at the end, I'll take questions, we'll do tips and conversations. I'll talk for probably like 30 minutes. And then if anyone has questions, we'll go from there. But like I said, like feel free to put anything in the chat at any point because it will be pretty informal. So we can go to the next slide, please. Safe. Okay, so I found it helpful when I was meeting like medical students or people who were introducing their career to me to kind of learn a bit about where they're from. And so I'm going to do the same for you. And then also you just know who I am a little bit. So I grew up in Newfoundland in Canada. I went to a pretty small high school, like less than 1,000 people. I grew up in a pretty small town, less than 20,000 people, and like no other towns around. So pretty rural. I graduated high school in 2019 and started at the University of New Brunswick in the September of 2019. When I was in high school, I knew that I was interested in health sciences, knew that I liked healthcare, but I don't have any family in healthcare. And I was pretty intimidated by the process of applying to medical school. I thought that it was something I was interested in, and it had kind of been encouraged. Like I did well in school. I liked being around people. I was interested in like how the body worked. I did a lot of sports, and so that was something that kind of like tied into that nicely. But I didn't really necessarily know what that path would look like, and so I did a kind of untraditional path to medicine, which we'll talk about throughout. But when I was in high school, I didn't really know what I would do in university. I kind of always knew I would go to university, but just didn't necessarily know what I would study to get me to the place that I wanted to be. And so up until like Christmas of grade 12, I thought that I was going to do engineering. I thought that I was going to do engineering and then like try and get into medicine after that. I didn't ever really want to be an engineer, but I liked math and physics a lot. And so I thought that would be a nice place to start to study. In Canada and the US, medical school is not something you start right out of high school. You have to do an undergraduate degree before you can apply to study medicine. And so that's why I thought about engineering first. It was something I liked. I was given the advice to do an undergraduate degree in something that I knew I would do well in because your grades are really important when they're looking at admission into medical school. And so um, I was kind of trying to pick based on like subjects I did really well in school and like would like studying. And then kind of by fluke, I found this program in interdisciplinary leadership, and it was like January of grade 12. So you're kind of like late in the game to be applying to new programs or like completely changing your focus, but still enough time. And so I decided I wasn't going to do engineering. I wasn't going to focus on math in my undergrad. I was going to do leadership studies. And it was a lot more like social justice work, comparable in some ways to like a sociology degree or like an arts and science degree. I still minored in health sciences, and that was kind of an opportunity for me to solidify that I was interested in medicine. And then I graduated early. I actually did 3 years for my undergrad. Most undergraduate programs in Canada are 4 or 5 years, but I condensed the program so that I would be able to do a master's within like 5 years. So 5 years to get an undergrad and a master's instead of 4 or 5 years to do a bachelor's degree. And then I started medical school in September of 2024 is where we're at. And then now I'm in my second year. So I'm at the Northern Ontario School of Medicine. I'm in the Sudbury campus. So anyone from Ontario or in Canada, you might not know where Sudbury is. You like leave Toronto and you keep going for like 4 hours, and there's a lot more north past where I am. But I really enjoy it. It's been a real pleasure to be here. And I'm currently located on unceded lands of Atikameksheng First Nation and Wanapitei First Nations. And so I'm very grateful for the people who have looked after this land for a long time because it's a real privilege to be here. But we'll go to the next slide. That's a little bit about me. Thank you. Okay, so in the next section, we're going to talk about becoming a healthcare provider. And these slides are basically going to go through like different types of healthcare providers. Yeah, thank you for changing the slide. So I'll start with my experience in becoming a doctor, and then we'll go through like nursing, rehabilitation sciences, social work. And again, like feel free to put questions in the chat. So I am currently in the process of becoming a doctor. Like I said, you have to do high school and then an undergraduate degree, and then you start medical school, and then you do more training after that. Some of you might have already heard, like it takes a really long time to become a doctor. I think that, to be honest, that's pretty lucky. There's a lot of things to learn in medicine, and so you want people that are being doctors to like know their stuff. And it takes a long time to learn it. I feel like 2 years in, I'm very much like there's so much for me to know, and I've been learning so many things like at a rate I had never learned at before. But there's still like always a million more things to learn. So the like traditional path to medicine is that you do an undergraduate degree. In Canada and the US, you can do an undergrad in like pretty much whatever you want. So this is your like bachelor's degree. Lots of people will end up doing like biology, health sciences, chemistry, like kinesiology, that kind of thing, because you tend to be interested in like how the human body works and how like cells work and that type of thing. I minored in biological sciences, so that's when you take like less courses than you would for a full science degree, but still quite a few science courses. And then focused on my like social justice major, which I really enjoyed, and kind of just opened a couple more doors in case I didn't get into medicine. Medicine is a super competitive field. There's a lot of really qualified people who want to study medicine, and there just aren't enough spots in medical schools. Um, and so that's something to plan for when you're considering this degree as well. It's like it is hard to get into. And so I have classmates who applied like 6 or 7 times into medicine before they've been accepted. Lots of times people are accepted if you continue applying, but it's not always a direct path. And that's one of the things that I think is unique about medicine when we're going to be comparing these different healthcare professions is that there are, like, I would say, a lot more barriers to getting into studying medicine than getting into studying a program that you can start right away in university or that you might not even need a university degree to do. So once you're in medical school, in Canada and the US, most medical school programs are 4 years. There are a couple that are 3, but the 3-year ones are condensed. So they're still covering like 4 years worth of content just in 3 years. The first 2 years are called pre-clerkship years, and it's more like didactic learning. So you're sitting in a classroom, you're listening to lectures, and then every like 6 weeks or so, you write exams. And it's 2 years of that. So it kind of mirrors what you would be doing, like almost in a high school structure, but then also again in undergrad. And then your third and fourth year of medical school are clinical based. So you're in the hospital, you're working like with doctors and communities, and you're learning about what it actually looks like to be a doctor. You're learning a lot more about like your clinical skills, but also how the healthcare system works, like hands on, and then like your role in an interprofessional healthcare team. So a major takeaway from this presentation today is hopefully going to be that you need all of these healthcare providers to work together. And every single person has a different job that is essential. Like a doctor could not do their job without the physiotherapists who also work with them and the social workers who work without them. And like the nurse wouldn't be able to do things without those people as well. They all really rely on each other. And so that's just a main takeaway. And then when you finish medical school, you continue your training. So at that point, you have a medical degree. You would like introduce yourself as Dr. So and so if you wanted to, and you have like an MD following your name. But you're still not certified to work on your own yet. There's still more learning to do. So at that point, you specialize into what type of doctor you want to be. So whether you're interested in like family medicine, like psychiatry, obstetrics, surgery, emergency medicine, like all kinds of different things, that's when you do more specific training to be like one type of doctor. In medical school, it's quite broad. And then you decide what you're going to do and you train in that. Family medicine residencies in Canada are 2 years, in the States, they're 3 years. And then like surgery residencies are up to 5 years. So you're still learning. In residency, you are getting paid. So you're like a working professional at that point, but you're still very much a learner. You're given some responsibility, but like not as much as you would be given when you're like fully licensed. Yeah, so that's kind of the quick overview. Like I said, it's not always a direct path. It's actually pretty unusual for it to be a very strict, like, did high school, did undergrad, immediately went to medicine, just went right through. I would say most people in my class have done like a master's degree in between, or kind of like thought about something else, worked somewhere else, and then they like find their way to medicine. But that's it. Okay, so that's a little bit about becoming a doctor, and we can go to the next slide, please. Okay, so this is about becoming a nurse. So nurses are like the backbone of the healthcare system. They are essential. And there are different types of nurses and lots of different pathways within nursing. There are actually quite a few people in my class right now that did nursing before becoming medical students, so like before training to be doctors. And when I was finishing my undergrad and didn't really know what I was going to be doing, I really considered applying to nursing school as well as medicine. I ultimately didn't end up applying, but I think if I hadn't been successful in getting into medicine the first time that I applied, I definitely would have applied to nursing school at the same time. So there are lots of different paths. First of all, you need your high school diploma. This is like standard for all of these healthcare careers at this point. But then there are different types of nurses who work in the healthcare system, and they're called different things in different places. So I apologize if this language doesn't translate exactly to your location. Pretty much universally, anyone who's done a university degree in nursing is a registered nurse after they write the nursing licensing exam. So that's called an RN, registered nurse. RNs have a university degree. They have studied for 4 years, or they have done an unrelated degree and then studied for 2 years at a university nursing program. So they've either done 4 years or 6 years, which isn't on the slide, but is also a possibility of training to become that. Once you're done the 4 years, like the bachelor's degree, you're done. You're a registered nurse. You're ready to go. Registered nurses work pretty much everywhere in the healthcare system. They do like public health things, but they also do a lot of nursing in hospitals. You might see them at like nursing homes and primary care clinics, like working with family doctors, doing like injections and aesthetics and like all kinds of different stuff. A nice thing about nursing is that you don't need to do extra training after you graduate to become proficient in like one specific zone. So you don't do like a certificate in like emergency nursing immediately as you finish to be able to work in an emergency department. You can be hired in an emergency department and then they'll give you the training that you need to do. There are like advanced certifications in things like intensive care and actually like emergency, where you would work a little bit differently, or you would have more training, for example, in like obstetrics, like delivering babies. But you don't need to be like a different type of nurse, and you can switch back and forth. So say you work in obstetrics delivering babies for like 15 years, and then you're like, you know what, I don't really want to do this anymore. I want to work with a family doctor and do like primary care clinic stuff. You can switch. You don't need to change what you're doing in your degree, versus a family doctor can't really decide like, oh, I think I'd like to be a surgeon, and just like switch once you're like trained for one thing. That's kind of what you practice, and it's a little bit more complicated to just switch over. So that's kind of registered nursing. So that's option 2. Sorry, it's a little all over the place. Option 1 is like the quickest way to become a nurse. So in Ontario, nurse who has done a college diploma, so that's 2 years through a college program, not a university degree, is called registered practical nurse. In other places that I've lived, it's been called a licensed practical nurse, an LPN. In Ontario, they call them RPNs. I'm sure in other places they also call them other things, but it's pretty much always practical nurse with a different letter in front. So an RPN is someone who has trained for 2 years. They're certified, they're a full nurse. The difference between an RPN and an RN, in terms of the training differences, they've done like less time to become an RPN. And so because of that, they deal with less like complex situations. So RPNs might be working more often in somewhere like a nursing home where there's less like medical acuity. So you have like less emergencies. People aren't as sick. You're not as much dealing with like switching meds and like keeping people alive all the time, more so like general care. So nurses do things like a lot of clinical skills. They do a fair bit of like procedural work. So like giving injections, a nurse would often do, putting in like different types of medications. They give out medications, but they do not prescribe medications. Physicians, so doctors are the people who prescribe the medication, and then the nurse is often someone who would give out the medication. So they still need to be trained in like what the medication does, how it might react to in someone's body, and be prepared to deal with like the consequences of that. But it's also a lot about the care. And so they do a lot around like social care, really just like looking out for people, which is pretty sweet. And they are huge patient advocates. So oftentimes nurses are the people who get to know the patients best. They spend the most time with them on the floor in hospitals, but also they just have a like a closer relationship with them, with patients in most cases, which is something that really drew me to nursing when I was thinking about what my career might be. They advocate for their patients, they know them best, so that's huge. And they have a little bit less responsibility, which some people really love. Sometimes it's so nice to be like, I know that I can help in this situation, but like I'm not the person who's going to be in the most trouble if this works out poorly, or I don't have to make this really hard decision all on my own. They're part of the care team, and so that's huge. So that's kind of the general option 1 and option 2. And then you can do enhanced skills. So nurse practitioners are registered nurses. So they've gone through the university pathway. And then they have worked for a minimum of 2 years, and then they do enhanced training for another 2 years of university to become a nurse practitioner. So they have just like worked for longer. They're more proficient in dealing with sicker patients. So in that point, they're working closer to like a physician level. They just got there through a different pathway. They can also like switch between specialties a little bit more easily, which also means that they aren't like quite as trained and specialized in one place as physicians are, and they have a different like approach coming from a nursing background. But they're amazing, and we're seeing a lot more nurse practitioners like in Ontario lately, which is fantastic. I also have that asterisk there that, yeah, sorry, well, just super quick, that you can switch between these programs. So if you start like as a college diploma nurse, as a practical nurse, you can do upgrading skills like later on in life and then become a registered nurse and then go from a registered nurse to a nurse practitioner. It's not like limited based on where you are. So that's that. We can go to the next slide. Thank you. Okay, so the next slide that I have is about rehabilitation science. And this is kind of a funky word, but it's basically covering like physiotherapy and occupational therapy. which you might have seen. Like, if you ever like broken a bone, maybe you've gone to physio after. Um, Maybe you've worked with an occupational therapist in your schools. We don't like see occupational therapists a ton in community, but they do some really important work. So I'll talk a little bit about physio, like overview what they do, and then I'll talk a little bit about like occupational therapists, overview what they do, and then I'll tell you how you get there. Um, so physiotherapists are basically like experts in all of the muscles of the human body. There's also a branch of this called kinesiologists. They also work closely with physiotherapists, but have a little bit less training. Physiotherapy basically is working like, yeah, muscle rehabilitation. So physiotherapists do not prescribe medications, but they do prescribe exercise and rehabilitation. They basically study how to get people like back to their baseline, but also back to their like day-to-day activities. Um, Typically like non-pharmaceutically. They might use like some medications when needed, but for the most part, they're very like exercise and like strength based. Um, Physios are like such a huge asset. All of the healthcare professionals do learn about like the muscles in the body and like how the body works, of course, but it's super complex. The anatomy is very interesting, but it's amazing how much physios know about like my shoulder hurts to move this way, and they're like, I know exactly what muscle it is and exactly what else would hurt it and what we need to do to strengthen it. So it's amazing. They're most like specialized in that area. um, and so they can do some cool stuff. Lots of times there will be physios who work in hospitals with like patients who have recently broken bones, lots like hip replacements and that kind of thing, but also just like gaining mobility back, working with kids to like help them if they've had an injury, or if they haven't had an injury but they're like at risk of having an injury. If they've got like a weaker area, they might work on them with that. So that's kind of what a physio is. Occupational therapy is also about getting people like back to their daily lives, but it's more focused on what's called the activities of daily living, which is something that you might hear about if you're interested in healthcare. ADLs, activities of daily living, are basically like the things that we need to do to like feel like humans and keep ourselves alive every day. So things like getting dressed, making food, like going to the bathroom, seeing our friends, like that kind of thing. And occupational therapists, so then they're a little bit more broad scope than physiotherapy, where they're not just focused on like getting your body physically able to go back, but they also do like mental health work. They can work with kids in schools lots of times to help them be successful in classrooms, like for learning. They can also do things like if putting your socks on is really hard, and not necessarily just because of like back pain, they might be able to like do like ergonomic assessments. So that's like figuring out the best way to help you like use different assistive devices to do things that you need, like putting your socks on. They also do a little bit more like mental health related things. Like I kind of said, they would be the people in hospitals lots of times who are doing like stroke assessments following a stroke, like when they're monitoring it, to see like what kind of things you remember, if you can like solve like word problems and that kind of thing. Doing different like cognitive testing is what we call it. And so occupational therapy is like a little bit broader in that sense, that it's like all aspects of life. And if you think about it, like occupational means like related to work. This is like allowing you to do like your daily work, whether that's like employment based or just like the things that you do during the day. So that's kind of cool. So for both physiotherapy and occupational therapy, they're kind of different pathways. Again, start with high school. It all starts with like figuring things out there and then what you're going to do next. So the main option to be like a full physiotherapist or a full occupational therapist is to first do an undergraduate degree. So it's 4 years. Coming up often, you often have to start with an undergrad. Um, People who do physio and occupational therapy typically find it really helpful to do like a kinesiology degree. Kinesiology is like the study of human movement and like the human body. So they would do like not a lot of anatomy. They would understand how muscles work early on in undergrad. My understanding is that this is helpful because physio and occupational therapy are master's degrees, so 2 years of extra school after your undergrad. And 2 years is not a lot of time to become like super proficient in all of the muscles in your body. There's just like, there's so much going on. And so it's helpful to have a background in it. And lots of these programs require that you to have some sort of background that has allowed you to study like anatomy and physiology before starting the program, so that you can focus on like the clinical pieces once you get there that you might not have covered in your undergrad. In contrast, when I was talking about medicine earlier, you can do any undergrad that you want because you're going to be training to be a doctor after your undergrad for like at a minimum 6 years, including residency, and like up to like 15. So there's going to be time for you to learn your anatomy because you're going to like see stuff over and over and over again. But physio and OT schools don't necessarily have that same model. You do the 2 years and then you're done and you're ready to go into practice. There is a little bit less like supportive learning throughout. And so, which is also super exciting, like 6 years and then you're totally done versus medical school. Like I'll have been in school for, this is my 7th year of university, I think. And I'm like so not even close to being ready to see patients by myself versus someone who's done physio, like at this point in the game is like practicing independently. So that's kind of cool. There are also other options to be involved with physiotherapy and occupational therapy without being a full physio or occupational therapist. There are 3-year college diploma programs to be physio and occupational therapy assistants. And so these people like work really closely with physios and OTs, or PT on the slide there sounds for physiotherapy. PT OT assistant programs. And so you can still like work really closely with them. You're just ultimately not the one who's doing like all of the full assessments. You would be doing more like programming with patients, like helping them out. Not necessarily like prescribing exercise mechanisms or like prescribing what kind of changes you might make, but like helping them to implement them. So still super rewarding, very important. And sometimes again, like when you have to apply to things multiple times, like physio and OT schools can also be pretty competitive to get into. I know a couple of people that did an undergraduate degree weren't successful in getting into a physio or OT master's program the first time. And so they did the assistant program, learned all of their competencies, and then now are super incredible physiotherapists and occupational therapists because they got in again after they had applied a couple times, but already had like so much background in understanding what it is a physio and occupational therapist do. And so then we're super successful in that. So that's what I have for rehab sciences. And we can go to the next slide, please. Thank you. Okay, so this is, I think, the last one that I have for like the type of healthcare provider. There are more healthcare providers. Like there's so many different types, but this was kind of like broad encompassing. And so this one is social work, and this is one that I find super cool. Social workers are like hidden gems in the healthcare system. Don't think that I think that they're actually quite overworked, but I think that they're also like we don't realize how much potential they have to be really supporting people. And like in other professions, like there's a ton of different ways that you can get there. There's different like levels of competencies within social work, but broadly speaking, social workers help people with like the social experience of navigating the healthcare system, but also just like social support in general. So you might think of that as like being a nice friend, which it isn't like exactly, but it does include like helping people figure out how to use the systems that they need. It could be things like you might think of social work in terms of like supporting people for their mental health. They could do counseling, but they can also do things like in the hospital, helping patients like figure out what kind of like dietary things they need. Maybe they might help them figure out what kind of support they need at home. They might help them figure out how they're going to get funding for the dietary and home support things that they need. They'll help them figure out like what going home will look like, how to support that, all kinds of different things. They do a lot of work with families to make sure that families are like doing well and are in good situations and all kinds of different things like that. It's a very interesting field of work, and it's a little less clinical, I would say. You're not doing like procedural work. You're not like hands-on on a patient in the same way that you are in medicine or nursing or rehab sciences. But you're like in nursing, like getting to know people really intimately. You're really like understanding their personal situations, and you're having like pretty difficult conversations with them, which is really like a privilege to be able to be part of, that people would trust you to do that. So that's pretty cool. So to become a social worker, step one, always high school. There are a couple of different options. You can actually do social work as a college diploma, which I don't have. I have that like with the asterisks underneath the slide there, but I'll put that before talking about the undergrad degree. So similarly to nursing, where you can be like a practical nurse if you do a college diploma program, you can do that for social work as well. And then you can either work at that level, that's perfect. So you'd be doing like a little bit less complex cases in that kind of situation, not really any research, but very like hands-on with people in community. And then another option to be a social worker is to have an undergraduate university degree. So this is like kind of similar to the nursing pathway, where you can do an actual undergraduate degree in social work. So 4 years, then you're a social worker. Ready to go. Again, you can like switch between fields if you want to do like family related stuff and then you want to do like hospital medicine, whatever, you can like switch in between. You don't need to have specific training to do either. You're done when you get your university degree. There are also bridging programs again where you can start with like the diploma program and then switch to the university program. Again, and I haven't said this before, but there are like pay increases that come with each stage of this. So the longer that you spend in school, typically, the longer or like the more money you would be making is kind of the general rule for healthcare. So like nurses who did the RN pathway, so through university, end up making more money like in their salary than practical nurses who did like the 2-year program. But then if the RPNs do the bridging pathway to become registered nurses, then they get bumped up to that salary. So that kind of just goes for all of the programs, and is something to think about. Finances are important. And then another option for social work is as a master's degree. So you can choose to do a master's degree after you've already done an undergraduate degree in social work. So kind of like the equivalent of like nurse practitioners where they have a nursing background already, and then they're doing like more skills in that specific area. But you can also do social work as a master's degree if you don't have a background in social work, and that's totally okay. This is kind of similar to like the occupational therapy and physiotherapy, where you probably have some sort of background in like psychology, maybe sociology, like an understanding of people, but aren't like trained as a social worker yet. And then you do 2 years as a master's degree, and then you are trained as a social worker. And so then you would be at like the same ish level as the undergrad degree people, where you're basically like dealing with more like complex situations. You can also like in all of these cases go on and do like a PhD, which would be like more research in this area. That's an option for all of these pathways. But to be like a clinician, this is kind of what we're talking about. Yeah, so that's kind of the pathway for social work. Some of the things that like people really like about it is the counseling aspect. People who are super interested in mental health do really well in social work, and it's really like caring about people, which all of these healthcare, like it's called healthcare. You care about people, which I think is one of my favorite things about learning to be a healthcare provider, and is something that is going to make my job really rewarding. Is it that you are really like curious about people's circumstances and like kind to them, and that your kindness goes like as far if not further than your like medical science knowledge or whatever you might have as your background. And so that's a very cool one. But social work is really like you make a really big difference by caring for people, and so that's kind of cool. And it's one that isn't talked about in healthcare all that often, but like there's social workers in every single conversation about patient care that's happening like in hospitals and in lots of other places, and they're just like super knowledgeable and very useful. So that's it. Okay, we can go to the next slide. Thank you. Okay, so like I said, like there are other careers in healthcare. There's not like 4 specific types and like that's it. There's all kinds of like administration work, clerk work. So whether this is like reception work, which is super important in like primary care or in hospitals, but also administration, like running hospitals, like more like logistics stuff is big. All kinds of technologists that literally like we could not do healthcare without. So whether that's imaging technologists, so like people taking x-rays, laboratory technologists, so people doing like your blood work, processing, all of that stuff is huge. And most of those like imaging technology and lab technology are college like 3-year programs. They're quite intense. You learn a lot. It's super cool. But they're essential and just like a different pathway that can be really interesting. Pharmacy is also really interesting. Physicians like work very closely with pharmacists to figure out like drug interactions, and they also get to be more like hands-on in the community, which is really nice. That's a nice option. There's also a very cool like pathway called patient navigation. This works kind of closely with social work, where it's helping patients like not necessarily get around the hospital, but figure out the healthcare system, like figure out working with their doctor and also a nurse and then also a physio and also maybe like a dietitian, and all of this kind of stuff. Patient navigation helps people just like pull all those pieces together because it can be pretty siloed like on its own in healthcare sometimes, where like the doctor isn't talking to like another type of doctor and they don't really know what's going on together, or like your physio isn't necessarily thinking about like your food at home and how that's working together. So patient navigation can kind of just pull all those strings together, and they would work closely with social work. Also, like food services, dietitians are super useful, but also people who are doing like food service college programs, to learn how to like prepare food in a hospital setting and like make food that helps people heal when they're not doing well, or that are like easy to eat when their bodies are in rough shape and all of that kind of stuff. So that's super cool, taking like a food approach as well, and like literally so many more. There's all kinds of stuff out there. Healthcare is like so broad, and I don't think I really fully appreciated that for a long time. So you'll know this early. And we can go to the next slide, please. Cool. Okay, so like I had kind of talked about in like my experience in medicine, there are not always these direct pathways, right? Like I presented to you and I said like, okay, you do high school and then you do an undergraduate degree and then you do a master's degree and you're a physiotherapist. Ta-da, that's it. That's how it works. There are like so many things that can happen that that's not exactly how it works. Maybe it takes you 6 years to do your undergrad degree. That's totally fine. So maybe you don't start physio until you're later. Totally cool. Maybe you want to be a doctor, but medical school is really hard to get into. And so you apply and apply and apply, and it's not working. And so you do nursing school instead, and then you get into medical school after. Or maybe you change your mind. Maybe someone you love gets sick, and you see what an impact the nurse had, and you said, that's what I'm going to do. Maybe you start out in business and you're like, I'm going to deal with numbers and finances all day. And then suddenly you're like, you know what? I think I'd actually love to be a dietitian, and you like switch things up. That happens all the time. Like there's so many people who go back to healthcare as like a second or third career. Don't think that this has to be a super linear process and that it's like one and done and you're there. There are a tons of different ways around things, and honestly all of the life experience that you have makes you a better healthcare provider because you can relate to people a lot more, and it's about like you being able to show them that you care. And so if someone says to you like, I'm just having a really hard time at home, like finances are really tough right now, and you can say like, yeah, I understand that, like I worked hard and I didn't know what I was doing with my life for a long time, like I can relate to this. It just makes you a little bit more approachable. And so not to say that like there's an advantage to either side, but it's not always super straightforward. And sometimes it's not your own choice for things to be different. Like I think lots of times the narrative on like social media about people like taking a gap year before medical school and they're like, oh, like I'm just going to travel and it's going to be so much fun, might actually because like they weren't accepted to any programs, and like that doesn't feel good for anybody, right? You're not like hoping to be rejected from 12 programs that you apply to. And so it can be really hard. Just like there's challenging processes, it is competitive, but like you can do it. People do it all the time. It's super doable. But just like remember to lean on your support networks and know that like what you're seeing on social media isn't always an accurate portrayal of like what's really happening. um, it is like not always an easy and straightforward path, and that's pretty normal, but you'll be definitely more resilient at the end of it. So you can go to the next slide. Okay, so I had been talking a bit about like traditional paths. So a traditional path is if you like do high school and then you do the university program and then you get in right away for like whatever program you're doing. And then on the next slide, I'm going to talk about non-traditional paths, but I'll start here. So for a traditional path, this is like I said, like not always up to you. Sometimes the universe says you will not have a traditional path to this school, but sometimes you do. Some of the like pros to this is that you get to start your career earlier. So like I'm someone who's had a pretty traditional path to school, which means that I'm going to finish medical school like in my mid-20s. I will be a physician like for my entire career, and I'll like start my practice early, right? Which is nice. It means that I like know what my life is going to look like. Things are kind of laid out in front of me. And it also means that like I'm going to have time to like feel like I can be proficient in things, which you get either way, but I just am going to know that that's the kind of path for me. Some of the cons are that you have less time to figure things out. So I feel like I started medical school when I was 22, and I was just like, okay, I'm 22 years old and I am going to commit myself to this, and this is what I'm going to do for the rest of my life. And that can kind of be too bad also. Maybe I would have liked to do something else. And I don't necessarily know that right now, but maybe like at the end of my 20s or in my mid 30s or wherever, I would have been like, you know what, maybe it would have been cool to like try something else first. So sometimes it actually like pigeonholes you, but that kind of happens anywhere. There's definitely a financial burden to just going right through school, like whipping through it all in one go. I was lucky to be able to work like full time for one of the years in my master's, and that like helped me a little bit. But compared to like classmates who had previous careers who were able to like buy a house in the community that we live in, who can like support their families and they've got funds saved up and they're not going like massively into debt, because they had the time to like establish themselves financially, it can definitely be a burden to just like accumulate debt over and over and over all in one go. And then another con is that like you do then sometimes get set to a lifelong career, and people are typically actually switching careers like 3 times now in the lifespan of their careers, and so that can be more challenging if you've trained very specifically for one career, like kind of figuring out how you're going to switch that up, which there are totally options to do, but that can also be daunting to be like, oh my gosh, I'm going to do one thing for the next 40 years in my 9 to 5, and that's what it is. But that's just like some things to think about that might happen. And we'll go to the next slide, please. So then for non-traditional paths, like I had said, like definitely a major pro is having an expanded skill set. The people in my class and the people who I know who have become healthcare providers after doing something completely different first are like the coolest and most well-rounded and also like down-to-earth people, because they get what it's like to be just like a regular person outside of the healthcare system before working in it for a long time. And whether that's like being an engineer first, working in finance, I have a couple of friends who were teachers before going to medical school. You kind of just like see the world a little bit differently, and I think that that's huge. One of my friends who is in her first year of a psychiatry residency right now, so she just finished medicine and is going to do like mental health specific work. She was a couple of years ahead of me in medical school, and when I was applying, she helped me practice for my interviews. And one of the things she told me, she actually said, I kind of wish I hadn't gotten in right away. And I was like, what do you mean? Like everyone wants to get in right away. It's such a strenuous process. And she said to me, like, I think it would have been so cool to get to like travel for a year and like work for a nonprofit and like do something different. And we actually had done the same undergrads. We had similar backgrounds. And it really put into perspective that like if I had done something else first, like it just would have been a cooler story in my life and a kind of neat different plot, which I hadn't really considered. And so she actually said, like, maybe if I had known things differently, I would have waited to apply to medical school for another year just to give myself time to like live life a little differently, because you also like study so much when you're in medicine and are very like focused in on that. You don't necessarily have time to be doing a lot of other things. So that's just a huge one, that increased perspective of the world and also the healthcare system. And then it's also a chance to confirm your path. I know quite a few people in my class who, especially in the first and second year of medicine, have had a really hard time if they don't know what specific type of medicine they're going to do or like what they're interested in, because they are now committed fully to being medical doctors, but they don't necessarily know like where that's going to take them or what they're going to do with that. And that can be super daunting versus people who had a bit more time prior to coming to medical school said, like, no, I know exactly what I'm doing here. I know exactly what I want to get out of this. Like, that is such good reassurance to have. And so sometimes the pro of having done something different before committing to like the healthcare career that you're going to do is just that you know that you want it and you might have different reasons for why. Conversely, some of the cons for a non-traditional path is that it is like a later in life training then, and especially for programs that like you have to be in for a long time. It's really hard to be in school from what I have seen of my peers, that are like trying to get things in life established. They're like raising kids and like buying houses and like have other things going on in their life, and then are also trying to be full-time medical students, and it's just a lot. And so that can be hard later in life. Also, you might have like different habits and different support systems, but that can definitely be tough. And like if you're just like a little older, sometimes it's hard to like go back to school. Another thing is that there's a little bit for like you can really think about if this is really the career that you want. There's more uncertainty in your career path sometimes if you're going back to something, saying like, is this the right choice? To have left something that was good to try and pursue something different. And like for the most part of the time, from the people that I know, their experiences, they would say yes. But definitely in first year of medicine, there were a lot of people in my class who said like, this is so hard day to day. It's just like a lot of studying. I'm away from my family. I'm not doing like all of the things that I wanted to do. And previously, I like had a comfortable life and a nice job, and I left that to go do this. Like, was that the right choice? So that can be hard. And then finally, just the duration of training time. So like we saw with all of the programs, like it definitely takes a long time to become a healthcare provider. And so thinking about like what that aligns with in your life, in terms of like your family and your loved ones and like what that might be, it can definitely be a challenge if you're like extending that through a non-traditional path. But there's no like right answer. There's no definitely you should aim to do a traditional path, or no like try your best to have a non-traditional path to medicine. It's just like different things to think about, that either way like things work out for people, but just something to be aware of. And then we can go to the next slide. Okay, so this is the end of what I had prepared for you, but like I said, like please put questions in the chat. My email is also on the screen. I know we're like coming up to 10 minutes left for questions. But the main takeaways are just that there are so many different pathways and so many different careers in healthcare. It is collaborative. We need all of these roles to work together to make things work. And so finding like what works best for you is the most important thing you can do. If you know that you want to work in healthcare, it's not necessarily like there's one right answer. Like figure out what works best for your priorities and your personality and what you're interested in. And like do what feels good. You don't need to force yourself to like do a career that isn't right for you if there's another one that is. And then the biggest thing is definitely just like kindness and curiosity are the most important things in healthcare. And so if you're someone who is kind and is curious, like stay that way and lean into that. And it'll get you really far in this journey. So my email is on there if anyone has questions later. But if anyone has anything they want to put in the chat, or if you want to unmute, I know we're being recorded, go for it. But thanks so much for coming today and for letting me chat. It's been a real pleasure. I hope it was helpful.
Thank you so much, Kate, for all the lovely information and for taking your time to share this with us. We'll now open the floor for any questions. So we'll give you all around 2 minutes to type any questions you have in the chat, and we'll answer as many as we can. If there aren't many questions that you can think of right now, as mentioned by Kate, you can always reach out to her through email, and you can ask her that way. But otherwise, we do have some questions that were sent to us during the registration form. So if no one has any questions, we can use some of those to get the discussion started. But I'll just give it a minute or so any of you can type any questions in the chat.
Thanks so much. Okay, I just see one question in the chat right now that I'll get started with in case there are other ones. So the question is it better to go to a private prestigious college before med school or better to go to a cheaper college? I would say there are totally advantages and disadvantages to both. In my experience, so I went to like a pretty small undergraduate program. I would say it was a huge advantage for me to be in like small class sizes with people who knew me really well, because they wrote me really excellent letters of recommendation because they knew me. Like they knew my personality, they knew how I interacted with people, they knew my work ethic. And so that was huge. I don't think that necessarily like the amount of money that you pay for your degree impacts anything for your like medical school admission. So like if you want to pay a lot of money and go to a private school, like do it. But I think the most important thing is like somewhere where you're going to be supported, first of all, where people are going to like know you and you're going to be able to find community to support you in doing well in your undergrad is most important. And then like finding people who know you, who will be able to write you good letters of recommendation is also good. But also just like go somewhere where you're going to have a good time. It's 4 of your years of your life that like are the most transformative. And so I would say like picking something that you're interested in. It doesn't really matter like what undergrad you do before medicine. And I would say like the advantages of more prestigious schools for other programs for things like engineering or business are often the like connections that you make from having gone to that school, versus in a medical school, like you're going to make those connections once you get to medical school as well. It's not like you need to do all the networking up front. And And so I would say go where you're going to like meet good people, where you're going to be able to be successful, and where people are going to know you well so they can support you, would be the biggest things.
Yeah, that's a great response. Thank you. I'll just give it a minute more in case anyone else wants to type any other question in the chat. And yeah, we can go from there. In the meantime, I would highly appreciate if all of you could take a look at the Google form that's on the screen. So please take a moment to fill out our feedback form. It's quick and your responses will help us improve future webinars. And you can also let us know which topics you'd like to see next. So in the meantime, you can fill that out.
Perfect. Okay, I see another question here from Mila about what do people in the biomedical engineering field do? This is a super great question. So one of my best friends is a biomedical engineer, so this is more like my experience of what she does. But it's a super cool field. So biomedical engineering is a subsect of mechanical engineering. So you're dealing with like moving parts and pieces, which is very cool. And it's pretty broad. I would say so. Like my best friend currently is working on building hospitals, so building like the healthcare system, which is pretty cool. But other people in her class and other people that I know who have gone into biomedical engineering and just my general understanding of it, do all kinds of different like any engineering related to the body or healthcare can fall into it. So things like prosthetics is one of the like very cool things that they do. Even like working on like assistive devices like contact lenses are like worked on by biomedical engineers to make them better, which is kind of cool. So it's basically like things that support your body to be healthy that are made by engineers. But there's a couple of programs. If you're in Canada, Waterloo has a really good program, and also McMaster has a really good program. And one of my best friends at medical school is also a biomedical engineer. So he doesn't work as an engineer, but did it previously. So you could also do both. From Ethan here, we've got what are some important skills and core values to someone in healthcare? So definitely, like I said, like kindness and curiosity are the biggest one. You should be someone who's like interested in people and hearing their stories. Someone who's like happy to sit with people and just like understand them is really big. I would say humility also, like the process of going into healthcare is quite humbling. But one of my favorite things about it is that you really reflect on like being able to be human. Also definitely like leadership skills are critical. Being able to like communicate well, collaborate well is huge. Someone who's professional, someone who's like willing to learn, and someone who has a lot of work ethic. Like you need to work for a long time to be able to have some of the competencies that you need. So those are my main takeaways. It's like kindness, curiosity, collaboration, leadership, professionalism are big ones. I hope that helps. Carter says, what extracurriculars, both competitive and value-based, do you think are worth taking part in as a high school student if you want to go into the medical field? So I would say, like, do things that you're just interested in was the advice that I was given. And if that helps you, like, narrow if you're into medical field, that's great. When I was in high school, I volunteered at a hospital for like an hour a week for like 4 years. And that was helpful for me because it wasn't competitive. It was really like playing cards with patients, but I got to understand what the patient experience was like and that I liked being in the hospital, which is really important because if I hadn't liked being in the hospital, maybe that wouldn't have been a good place for me. I would say like things that also like encourage you to work with people. So kind of in relation to like Ethan's question, things that encourage like collaboration and communication. I did competitive sports, and I think that I often reflect back on like being an athlete as like learning to work on a team and then learning like to communicate my needs and take care of my body and like thrive under pressure were also big ones. But I think the biggest thing is like things that you're excited about, things that you can like reflect on. Also, don't just say like I played soccer and it was good because now I'm like able to run fast. Like be like, okay, I liked soccer because like of the team dynamics or because of like the opportunities to like work with other people or things like that. So sorry, it's not a super specific thing, but I would say do a couple of things that help you like decide if you're actually interested in healthcare, and then also just like do things that you find fun and entertaining. Yeah. And then when you're in undergrad, I would follow the same advice. Pick a couple of things that you're really passionate about, and that's what's going to get you the farthest. Yeah. We have a question here. What's the best thing to do in high school to set yourself up for medicine, healthcare related pathway? I think in high school, one of the biggest things you can do is definitely like decide why or if you are interested in healthcare. So whether that's like volunteering at a hospital talking to your own healthcare providers about like what they did, why they enjoy it, figuring out like what you're interested in is early on. You've got time, right? Like there's lots of stuff. You don't have to go right into a healthcare field in university. You can take a little bit of time. But I would say like asking questions about people who have jobs or like careers that you are interested in is something that would be super helpful in high school. So like coming to these webinars, that's huge. And then also like trying to visualize where you want to be in a couple of years probably would be helpful. But I think the biggest thing is like talking to people in positions that you think you might be interested in, and whether that's like also watching like social media videos about them or like listening to podcasts or like literally talking to your pharmacist or family doctor, that would be helpful too. These are really great questions. Another one, what is a reality that high schoolers should know about this pathway and what are misconceptions that they hear too often? So I think a thing that you should know is that like this is challenging. Okay. My first year of medicine, like of studying in medical school was the hardest year of my life without a doubt. Like super hard. And I had done quite academic rigorous programs previous to this, and like nothing compared to my first year of medicine. This year, second year, like I've got my footing. Things are a lot better, but it was a really, really hard transition. And I think that there's a lot of glamorization of this process of saying like, so exciting. You wear a stethoscope, you wear scrubs, like you show up at the hospital. This is super cool. The reality is that this is like, there's so much to learn. It's very challenging, and people's lives are literally on the line. Like things matter. And so I think that's just something to know about, is that it's not all like rainbows and butterflies, which I don't think people necessarily think it is. But also like it's super attainable. I think that I was definitely someone who often heard that like medicine's competitive. Like, are you sure you want to do this? Um, is it worth like the risk of being rejected over and over and over and over again? And I would say yes. Like there are people get into schools, right? Like people become doctors and nurses and physiotherapists and occupational therapists and social workers and all kinds of other things. And so like putting some belief in yourself and working hard goes a long way. And yes, it will be challenging, but like it will also be so rewarding. So hopefully that's helpful. What inspired or motivated me to provide a career in healthcare? I think a big one for me was definitely like watching my grandparents age. I'm pretty interested in like older adults and their health, which is kind of niche, but um, I would say that like watching them navigate the healthcare system and seeing like both how challenging it was, but also like the impact that their healthcare providers had on them was huge. And so that kind of like sparked my interest. And then it was kind of the experience of genuinely like my kindness and curiosity being as important, if not more important, than my like science knowledge, was something that I hadn't found anywhere else. I was like considering other careers, right? And I thought, you know what, like I want my like personality and general like view of the world to be really like valued in a situation, and it is in other ways as well. But I think that like being recognized for like caring about someone being as important as being recognized for like understanding the pathway to diabetes was huge for me. Like that was what was going to make things rewarding. And so that kind of like is what continued to propel me into medicine, and I think is what's going to make it a fulfilling career for me. If you like to research and study microorganisms, that's a super great question. So in healthcare, definitely, like I would recommend looking into research programs. There are so many like medical research people that are like pushing healthcare, right? Like we need like drug researchers and microbiologists and clinical like pharmaceutical people that are able to understand this kind of thing. And so lots of times people who do like research and studying microorganisms end up in like a PhD type of situation where they either work like with a university institution or also with healthcare institutions to study different microorganisms and like microbiology. So I would consider that. It's not so much like clinical training. There are also like medical, like MD, PhD pathways where you get a medical degree and a PhD. And that could like lend itself to that if you want to do a little bit more clinical work. But I would definitely say like look into like medical microbiology programs in universities, and they'll probably get you there. We have a question: how can someone taking pre-nursing or pre-med shorten their time in college? Yes, so I did my undergrad in 3 years. That's one of the ways I shortened my time. You can, yeah, you're welcome. You can, it's hard. Like you want to shorten your time and you also want to like know that you're in the right path. And so taking the full time is good. I would say like logistically, I took courses in the summer. Like the reality of it is that I did typically like most undergrad programs are somewhere between like 8 and 10 semesters. So whether you do 8 semesters where you're doing like 2 per year for 4 years or 2 per year for 5 years, I did 8 back to back. So I did like fall, winter, summer, fall, winter, summer, fall, winter. And that's how I like shortened my undergraduate study time. Um, yeah, it depends on the situation. It depends on like what's offered. Definitely like taking the prereqs that you need early, so like courses that you need to get into something like early on in your degree, you might be able to get in a little bit sooner. Some programs in Canada and the US let you apply like in your third year of an undergraduate program instead of like to start when you're done your fourth. So that might be one as well. Um, yeah, that's my advice. You can either like take condensed courses where you're taking like an extra semester or an extra like course per semester, or like preloading things a little bit might help. And my favorite thing about being in healthcare is definitely like getting to be part of people's journeys on like some of their really hardest days, but also some of like the happiest days of their lives. It's like such a treat to people to have people just like trust you with their personal lives and like want your perspective on it, and to feel like you're like really part of like empowering them to make a good decision that will like allow them to live the life that they want to live has been huge for me. um, it's just like it's so nice to get to be part of people's lives with them and have that role. And then also like the science of it is super cool. It's so neat to be able to say to someone like, this is like a scary diagnosis that you've just got, and I know that we're going to figure this out together. And also like I understand what's happening in your body and I can tell you and help you understand that, and we can like work through it together, and then things won't be as scary. So I think that that's also very exciting. But my favorite thing is definitely like the connections with people. And I think that we're a little bit past time, but thanks so much for the great questions. My email was shared, and like feel free to share my slides and contact information if you need it. But thank you, Kindness and Smile Zone, for having me. It was really great. And thanks so much, everybody, for your attention and for your questions.
Thank you so much, Kate, for joining us today. And we're going to wrap it up right now. Thank you so much, everyone, for joining and for your questions. We hope you got something out of today's session, and we hope to see you at our next webinar. Have a lovely day, everyone. Bye.